I'm here with Alae Kawam from Digital Pathology Place, and I love talking to Alex because she's really good at getting all the ideas and summarizing them and telling us what we need to care about in the digital pathology world.
Learn about the newest digital pathology trends in science and industry, meet the most interesting people in the niche, and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexandra Zhurov.
As we know, digital pathology, there's a lot going on. All right, so what are the highlights that you feel are you learned from this meeting?
There are two things. I think there are three, but I don't know if I remember the third one. So first thing is hype and real work on foundation model made it to this conference. Meaning it's getting to the pathologists, so it's not just some research thing floating in the air. We actually have integrations with software, with image viewing software that can access the models, both vision models and vision text models. So I think this is a new trend going on that I'm seeing is being communicated clearly. Another thing is the direct to digital pathology. I've seen several companies doing direct to digital imaging. People are still a little hesitant, and by people I mean us pathologists, because we're used to glass. There is a strong push towards direct to digital, which would put us as a specialty right where radiology was when they started digitizing. Actually, they were in a different situation where they had the option to digitize images before they were able to view them digitally. So they had to analogize images and print the film. They were in an opposite position. We are in the position where we are digitizing analog, but there is a trend happening to do the direct to digital, which I think is going to increase adoption very, very much. And the third thing, figuring out how to integrate AI. A lot more people embrace AI. There are different apps that are being trusted by pathologists. The question now is, okay, how do I integrate it into my daily workflow? And I have seen some solution to this problem already. Some people are still struggling, but there is a trend in the direction that it's going to be visible directly in your digital workflow.
There was a couple vendors who are actually building it in, and they're like, yeah, we can integrate into Epic, for example, and we can work on this and that. So AI is happening, everybody. It's just a matter of,
But we're still looking at it, so you don't have to worry that it's going to be like an automatic sign out or anything.
Yeah, so it's actually pretty cool. One of the vendors inside in the exhibition hall actually has the AI kind of algorithm built in, so it'll like triage your cases. So like, okay, here's the prostate cancer case. It already measured the core for you. It measured the amount of cancer. It gives you the percentage in a prostate core. I mean, this excites me because as a general surgical pathologist, sit down and measure each core like manually. I'm measuring the core. I'm kind of you're measuring, you're measuring, and you're also kind of eyeballing at the same time. So reproducibility is always an issue because you give it to two different pathologists, you get two different answers. And then, I mean, what's nice about the AI is it does it automatically, gives you the percentage, and then even gives you a Gleason grade.
Yes.
So it was actually pretty cool. And then all I have to do is like, yes, I agree, this is a 3.3 or 3.4 or 4.3, and I'm always arguing with myself whenever I'm doing a prostate, is this a 4.3 or a 3.4? Because sometimes it's not so clear.
To me, like estimating it visually is beyond the physiological visual capability of a human.
So why do we do it?
And I don't know, was it Mr. Gleason or Miss Gleason that invented the scoring?
I feel like it was a Mr.
They had some supernatural visual capabilities to actually estimate that.
Yeah.
And it's a very granular, like it's a seven point scale, right?
I mean, look, the technology exists to get rid of that like gray zone, so that where you're more able to accurately diagnose these kinds of cancers. Going back to this AI thing that's integrated into the system, it does triages it for you, and then you actually review it. You get a chance to review it. It generates a report, and then you agree, click, 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 done. I mean, normally it takes me like at least 40 minutes to get through prostate biopsy. It's usually like 1 to 2 trays, so you're looking at 40 slides or so, because they sample the prostate extensively. And here I can do that in 15 minutes. So if you're thinking like, okay, how do I, business model? This is efficient. This is a lot faster, and it saves you time.
More pleasant for the pathologist as well. It gives the pathologist more confidence in whatever they're signing out, right?
And for the patient, most importantly the patient. I mean, you're getting the exact measurement of the core, you're getting the exact measurement of, you're not getting an eyeball thing. Not to scare patients away or anything, but sometimes you end up eyeballing things.
And it's not pathology specific. It's like any image-based or visual specialty. Before you have the tools, this is how we've been doing this, and a lot of us is still doing it that way. And that's the best we can do. But if we can do better with tools and with technology, then I think we should.
And so one thing that you actually mentioned, going digital, like
direct to digital from tissue.
Direct to digital. I mean, DICOM, the standardization of medical imaging. I think radiology had to do it first, where medical imaging had to kind of go through this process, and everyone was like, oh yeah, nobody questions radiology, how they did it, why they did it. But here we're getting a lot of questions. What's our return on investment? What's this, that, and the other thing? Not realizing that, well, it actually is the equivalent of radiology. So we actually had a couple of speakers from SIM, which is
Society of Imaging Informatics in Medicine, and they have a lot of radiologists, but they start having more and more pathologists as well.
Again, it's an image.
Listen to those recordings.
It's an image, right? So there has to be some type of standardization of these kinds of images that are coming in. So that was actually really nice that there's that movement, that standardization, and that parallel with radiology. So that, I think, to me was something like, okay, like we're headed towards a standardization realm. We're not just like talking like, oh, we're going to do it. We're going to make it official, and we're going to do it, and we're going to do it well. So that was really refreshing. Those are kind of like the things that I noticed and learned about. Obviously, we're always making the case for digital because it's not being adopted enough, and everyone wants to make it. It sounds like a lot of the presidents that we had speak want to make it the standard. And I remember talking to you about this. Remember the first time we met? I was like, let's make digital pathology just pathology.
Just pathology. Like nobody says digital radiology, right? I mean, they had a long journey as well. So if we can capitalize on what they have learned and leverage what they had, then we're going to be faster.
And I think the joke is like, make it the not gluten-free option. Like it's the option. It's not the gluten-free option.
Exactly.
It is the option. And think about it. Like everything goes digital. You have databases of information. You've got AI models that are learning from this information. The opportunity is so vast. And I feel like there's two different like ways of thinking. There's like the pathologist way of thinking, which is like, how's this going to make better patient care in the end, more efficient workflow, more accurate diagnoses, obviously, and then there's like the business side, or there's like actually two sides to the business side. There's like the return on investment,
and everything has to meet.
It's interesting because it's like you have the business side of like, okay, so there's the return on investment, there's the money, but then there's like the operational side. There's just so many things, and I can't help but not mention the wellness side.
I wanted to say that.
Great minds think alike. Great minds think alike. So the wellness side, the flexibility. I mean, staffing is an issue. Everyone's suffering from being understaffed, right? And that was mentioned so many times during this conference. So staffing issues, obviously wellness. I mean,
let me tell you a story. So I was talking to a lab manager from a big lab. They told me, oh, we're losing 2 pathologists and then 1 more is retiring. But we're now here to figure out how to go digital, because those 2 pathologists who actually are going away, they would be happy to work part-time if it was digital. So they're basically making it happen to keep the pathologists that they already know and worked with in the company, in the lab. So I thought this is it was the first time when I have experienced this being a driver of digitization. Usually, I try to promote it because I work from home and this is a game changer for me. I have 2 little kids, and at this time of my life, if somebody wants to recruit me away and they tell me there is no option for digital, I don't even talk to them. But it was I was not in a position to require that for somebody to actually go digital. And these 2 pathologists who wanted to go away but say, okay, we're going to stay part-time if you give us digital, basically drove the adoption, drove the digitization of that lab.
And it's nice because I actually was talking to some vendors, and you can choose to kind of transition into digital. You don't have to make your complete platform digital. You can actually make certain parts of your workflow digital. Obviously, for it to go completely would be more efficient, but there are vendors out there who are actually you don't have to do everything digital. Here's what you can choose to do digital, and we can work with you.
Workflow.
Yeah, so when you have, look, the reality is there's some pathologists that their experience, their years of experience is invaluable. We can't lose them as a company, whatever that company was, right, or organization. Too valuable to let go of. And if they're still
company
going to work,
and to the patients, who's going to diagnose them?
That too, right? And it takes time to make a pathologist. Yes, you do residency, yes, you do fellowship, but I have to say, as a new pathologist myself, it does take time to get that diagnostic comfort, you know your stuff. but it takes time to really get to that level of like, okay, I can do this,
Yeah.
with my eyes closed. Don't do it with your eyes
No.
closed, everybody.
For an image-based specialty, I would not recommend that either.
Don't do that. But
But yeah, just basically to be fluent, be
Yeah.
confident in yourself. And also that level of confidence allows you to ask questions when you know you need to ask questions. Because at the beginning, like you want to ask questions about everything, you reach a certain level, well, okay, I'm confident in doing this. This I have to take to somebody else. And you don't need to take it to somebody else because you can send them an image.
Exactly. So a lot of advantages, not just on sign-out level, but on like the large-scale
Global
function.
care level, I would say. A super cool aspect about PathVisions, for me personally, as somebody who's pretty active online, I meet people that I met online in real life. And then we just like see each other and like, okay, we've never met. But we are actually friends, and that's what happened with us at the previous meeting. We were already in touch online, and I think this online activity, there's more and more of that. Pathologists are becoming, from being this like kind of invisible specialty, are coming out online. LinkedIn is the main platform for medical professionals where they are active, creating awareness and basically showing everybody in the world that pathology is the gateway to care. Like without pathology, you don't know what the care is gonna be. I love that about PathVisions, about DPA, and about Beyond the Scope, so everybody can listen to this podcast.
Yes, please listen to Beyond the Scope, and please, if you don't follow Alex already, please follow her.
Thank you so much.
Like you said, it's a great way to meet people and network people, opportunities, whether you're looking to grow in your career, make pathology friends, or just honestly...
Or meet us next year. It's gonna be in
San Diego.
San Diego. You can be here in person with us and be interviewed for the Beyond the Scope podcast. Also, maybe for the Digital Pathology podcast, which is my podcast.
Awesome. Thank you so much.
Thank you so much.
Thank you.